Hello, I'm Dr. Geoffrey, board certified emergency medicine physician. In today's episode, we will answer the question, will your ER treat you for an STI? Will your emergency department treat you for an STD? An STI is simply a sexually transmitted infection. An STD is sexually transmitted disease. Same thing. And the answer to that is yes. Let me just tell you how. For the females, we do a pelvic exam and then we take a swab using something like this. And then we send that off for a culture. For the males, we also take a swab for you, except we take the tip of your penis, that little opening called the orifice where the urine comes out. We will take this swab and stick it all the way down your orifice, move it around because we've got to get a good sample and pull it back out. Yes, we will test you for an STI, and we will also possibly treat you for an STI. A few caveats. If you come to be tested too early, it may be negative if you have a sexually transmitted disease. In other words, we call that a false positive. Let me give you an example. If you have sex with someone with an STI at 12 o'clock on a Monday, and then you come on 12 o'clock on a Tuesday, it's very often that test is going to be negative, but yet you may very well have an STI. The most common signs and symptoms for STIs, and not limited to this list, are a vaginal discharge, penile discharge, pain with sex, and often there's no signs at all. Just real quick, often women have a vaginal discharge, which is normal for them. Without an STI, often women have a normal vaginal discharge. Men, any penile discharge that you have is abnormal. Any penile discharge you have is abnormal. Meaning the signs and symptoms, as we just talked about, are vaginal discharge, penile discharge, abdominal pain, pain in your genital area, burning with urination, burning at the end of urination. There are many more signs. And again, as I mentioned, pain with sex. If you think you have a UTI, it is very important to be tested. Hey, I hope you found this video helpful. Hit the subscribe button, and I can't wait to see you in the part 2 of will your ER test you for an STI? Will your ER test you for an ATI? Stick around, can't wait to see it.